The World Health Organization says international travel should still be avoided. It warns that progress against the pandemic remains fragile. The message comes as European Union member states prepare to reopen borders to vaccinated travellers. Stuart Smith joins us live now from Brussels for more. Stuart, a major pushback from the UN health body.
Yeah, is especially concerned that this is something we've seen before. Seemingly the number of cases going down, people relax, and then they go up again. The World Health Organization Europe's high-threat pathogen team says when the curve flattens, it's not time to drop our guard, but to raise it higher. So we do not have to return to a lockdown situation. Complacency is not our friend. And there are pockets of increasing transmission in Europe, although in general, it is going down. One of those pockets of increasing transmission is in Portugal, which itself opened up international travel to people without vaccines. For example, the UK. UK travellers can go into Portugal just upon providing a negative COVID-19 test. And in the last week, we've seen infection going up. That's what the UN's World Health Organization is worried could be the picture we see in the future in Europe if proper measures are not taken into account. So they're recommending this is not the time. It's still in a very precarious situation.
So bearing in mind those pockets of infection that we're seeing popping up in different European countries, Stuart, are European authorities even confident that they can manage the pandemic after reopening their borders like this?
Well, the proposal which the European Council is looking to agree, potentially as early as today, has a small mechanism in here designed to be used as an emergency brake should the infection rates from particular countries seem to get too high. So the way this is working at the moment, the plan would see people coming from countries with fewer than 75 in 100,000 cases can enter Europe without having to quarantine. If, for example, a country was found to have a variant of concern, for example, or rapidly increasing infection rates, the EU says it could force an emergency brake to stop travel from those countries. And 75 per 100,000 may sound like quite a high limit, but compare that to some European countries like the Netherlands and Sweden. They're above 500,000 cases per 100,000 people. So compared to the rest of Europe, that's actually quite conservative. All of this designed to try and get travel going again in Europe, especially in those countries like Portugal and Greece, which have been so hard hit by the pandemic. But one other piece that might help European leaders feel slightly more confident about opening up the borders, the vaccination programme in Europe is now speeding up. And as it stands, 40% of people in the EU have received their first dose, nearly 20% fully vaccinated. So that is another piece of hope for European countries hoping to reopen international travel.
Stuart, thank you very much for that. Stuart Smith there, live for us in Brussels.